I'm Dr. Anderson, and I'm the Suicide Prevention Coordinator for San Quentin.
What inspired you to pursue this career?
Growing up, my family was a foster family, so I think I saw so much need for mental health services for kids, for families, for parents. I've lost loved ones to suicide, so I think that's always been kind of driven my passion for it.
So what factors causes the suicidal ideation?
I mean, it's so complex because it can be a number of things. Yes, it could be a chemical imbalance. There's mental health disorders, so there's a genetic component. People that experienced abuse, some sort of trauma, or somebody who engages in substance use is more likely to experience suicidal ideation and engage in those behaviors. When someone dies by suicide, we always look at it, and you kind of try to identify what happened, and then that's where we pull out what are the risk factors. Some people throughout their life they'll have chronic thoughts of suicide, and then there's people who go through something really terrible and have those thoughts.
Generally speaking, just people that are going about their ordinary lives out there, if they were to attempt suicide or even express the ideation, what would happen to them at that point?
Well, I know there is such a stigma, and there's so many misconceptions, I think, about what mental health looks like. And I think people just picture what they've seen in movies or, kind of the most extreme. But, it's actually pretty hard to be hospitalized. And there's so many different, avenues for people to get help. There's a medication component. There's, individual therapy. There's group treatment. Now there's video and telephone visits. There's almost something for everyone out there.
If you could say anything right now to a person that is struggling with suicidal thoughts, what would you say to them?
I would just say, ask for help, talk to somebody. There's somebody out there that will listen and help, that it can get better, that there's something out there that can help you. It doesn't have to be medication, it doesn't have to be treatment, but there's people out there that do want to help. There's people out there that care. Sometimes it is just a constant battle for people. People struggle for their whole life with mental health. That doesn't mean they can't have a good quality of life. Suicide's preventable, and suicidal ideation's treatable. Mental health disorders are treatable conditions. That's why we do what we do. I wouldn't be doing this if I didn't think people could get better. There's people out there that do want to help. There's people out there that care. Life can get better.